Well, good morning, everybody. Thank you so much for joining us today. I'm really excited to bring you the product overview for individual and family plans with Cigna Healthcare. My name is Sheila Pryor. I am the broker distribution manager for the Mountain West region, as well as working with some of our national partners like you guys. So really appreciate your time today. I like this to be interactive as possible. It's really difficult when it's virtual, but if you do have questions, please interject while I go. And if you want to hold them at the end, that's fine too. So with that, a quick overview of our agenda today. I'm going to really talk about Cigna's value as a company and then focus on some of the member values, and so that you really know when you're selling to customers what they're really going to get as being a participant and a member of Cigna Healthcare. We'll go over the footprint and the product portfolio, some specific market insights that you might want to be aware of, and then some of the broker resources and enhancements that we've made this year, which I'm very excited about. With that, I'm actually going to go off camera so I don't distract myself. All right. So last year, you may or may not remember, we actually had a little bit of a rebrand happen. We are now, as the overarching company, the Cigna Group. Underneath that is the division of Cigna Healthcare, which is really the sales and distribution of all of the products and services that we bring to market. Think of U.S. employer, individual and family, Medicare, Medicare supplement. And then we also have our Evernorth Health Services division, which really holds kind of our data and analytics resources, as well as our Express Scripts division, our Accredo division, and a lot of other services that we bring to market, which you'll see as we talk about pharmacy in a future slide. So here's kind of the snapshot of how the hierarchy works within the organization. We service over 178 million customer relationships. We have 172,000 plus behavioral health providers treating children and adolescents across the country. And then we have over 2 million relationships with healthcare providers, clinics, and facilities. So Cigna has a very strong brand footprint, and that helps us bring tools and resources to you to help service and keep your clients engaged with us. So you always have access to the Cigna for Brokers account. That's our gated resource site that includes your tools, your book of business, and training resources. You also have dedicated account managers and broker managers like myself, and our broker support team, who's available Monday through Friday, 8 a.m. to 8 p.m. Central Standard Time. You also have access to all of our branded quote and enrollment tools, our on-demand training resources, and our resource centers as well. So things about Cigna, obviously, we are a kind of a household name. Most people know who Cigna is. We are a financially stable organization. We're a current Fortune 500 16th ranked organization. Believe it or not, we've been in business for over 230 years. So we've been doing this a very long time. And you see that in some of our strong provider relationships across the country, leveraging our commercial partners. Some of the key principles for us for 2025 are really focused on retention of our membership. New members are great, but retained memberships and renewing memberships are also very pivotal to our business. It helps us keep them engaged longer term with us so that we get to understand them, know what kind of treatment needs that they might need, and see how we can engage with our clinical team and maybe our pharmaceutical team to provide them additional support. Obviously focus on our strong broker partnerships. We know that brokers are the lifeblood of this business and are pivotal to the trusted advisor relationship between you and your clients. So we value that very much, as well as creating plan designs and giving tools and resources to the customers to provide value beyond just the health benefits that come along with their insurance plans. So shifting to the member value, this is my favorite thing to talk about, you guys. We do a really good job of putting resources and tools in the members' hands so that they can really engage and navigate their healthcare journey. So we'll talk about the My Cigna tools, virtual care, pharmacy resources, and then our rewards and discounts program. And finally, our personalized customer service model, which I really, really love. My Cigna has been around for many, many years. I am a personal user and have been for probably over 15 years. So My Cigna is not only the web portal for members to access all of their claim resources, locate providers, and compare costs. They can pay their bills online here as well. And if they're using the mobile version, they can access their digital ID card at the point of service, which is a really nice offer for them so that they don't have to have a physical card in their wallet. Maybe they forget it, maybe they've lost it. the digital card is a great resource for them. So they have access to my CIGNA, both mobile and on the browser version. We also embed virtual care in all of our products. If COVID taught us anything, we need to meet people where they are. And so virtual care has really taken off over the last few years. We actually own MD Live. That's our preferred vendor for virtual services. And that's accessible through mycigna.com. Think of this as coverage for things like urgent care visits, routine primary care visits, preventive labs, prescription refills. We also added virtual dermatology as well as behavioral health to this benefit. And we actually launched something a couple of weeks ago that is really cool via MyCigna through MD Live. It's called an Eat Treatment option. And so what this allows members to do is really utilize services on a low acuity basis. So think of, maybe I think I've got the flu, or I have a urinary tract infection, or maybe an earache or an ear infection or an eye infection. I can use that e-treatment option, put in my symptoms, and within an hour, they will turn around a treatment plan and potentially even pharmacy fill for prescription services. So this is a really, again, great way to meet customers where they are for low acuity things that we know maybe they don't need to see a provider, but they can triage the treatment pretty rapidly. Shifting over to pharmacy resources, as I mentioned before, most of this lives underneath our Evernorth division. So home delivery services for pharmacy are powered by Express Scripts. Our specialty pharmacy is Accredo by Evernorth. So if you have members who are on specialty medications and need those coordinated and shipped to their home, they would work through our Accredo division. And then in all of our markets, with the exception of Texas and Virginia, our formulary network is the Walgreens Advantage Network. But don't limit that to just Walgreens. Think of it like a totally national network of resources for them. So it does include Walgreens. It also includes CVS, Walmart, Costco. Think of Target, even some commercial grocery chains are going to be included in the network. So your members really shouldn't have any issues on a national basis finding pharmacy resources pretty close to their home. Our rewards program has improved this year. So in years past, if you didn't use your points, they stopped at the end of the year and they just went away. So we've installed the program upgrade to roll over those points year over year, which is a really nice benefit to our renewing customers. Now, this program was really designed to help your members engage with us as their health plan. So things like taking a 3-minute health assessment earns them points. Those points equate to dollars, which can then be redeemed for a whole slew of things through MyCigna. So they can redeem them for Visa gift cards if that's what's of value to them. If they want to buy a new air fryer because they want to participate in a healthy lifestyle, they can do that. If they want to redeem it for different experiences and travel items, they can do that too. Customers can turn up to $325 through the calendar year, and this is available for anybody that's enrolled on the plan that's over the age of 18. And the second milestone we really want them to participate in is their annual wellness exam. By doing that, they get $100 in their Take Control Rewards profile. So easy ways for them to engage and for us to learn a little bit about new and renewing members. And then lastly, they have the Healthy Rewards Discount Program. This program was designed many, many years ago to fill the gaps of things that were missing from a traditional health plan. So hearing aids and exams, vision services, fitness club and membership discounts, and maybe even specialty provider discounts that are a little bit outside of the box, like acupuncture and chiropractic on the plan. So all great resources for your members to take advantage of. And then talking about the personalized guide, this is our One Guide program. So this is a way for members who are experiencing something complex to go directly into a care navigation team without having to go through the traditional member service channels by dialing the number on the back of their ID card. So I'll give you a couple of examples. One, maybe you have a member who gets a diagnosis of cancer or something that's pretty catastrophic. They don't understand how they really need to coordinate that care between maybe the diagnosing provider and maybe the surgery team and the hospital entity and the labs and all of that. They could call our team to help get coordination across all of those spectrums. Maybe you have a member who gets a pretty unexpected bill and it's not lining up with their explanation of benefits. This would be a great time for them to use a personal guide so they can sift through all of that and help the member understand what really is their responsibility. Was the claim processed appropriately? Did they need to look at having that claim reprocessed or engaging the provider in some way because there was a disconnect? So again, a really great value-added service for your clients, again, to bypass that typical member service experience. Moving on to our individual and family plan footprint. So this year we are exiting 3 states, Utah, South Carolina, and Pennsylvania. So in 2025, we will be in 11 states, in all of those shaded in the dark blue that you see there. We are also exiting a couple of counties in Indiana as well, and Florida, but that will all be communicated to you guys. I also want to make mention of the fact that we do have an individual and family dental product. This product was really built for all ages in mind. It's age rated based on the geographic area. We are filed in all 50 states. Not all products are available in all 50 states, but we do have product in most states. And the great thing about this is that you could sell this to your under 65 clients. You could sell it to your over 65 clients. There's 3 different layers of plans in the product suite that I'll go through in just a second. And you can access these by going to the CIGNA for Brokers portal. So our top level is the preventive and low deductible plans. So these are really meant to be kind of like that base dental coverage for them. If they needed more, they probably want to look at a DVH plan, which is a bundled dental, vision, and hearing plan, or one of our high annual maximum plans if they needed additional coverage. I want to call out a couple of things here from a product portfolio perspective. Number one, our CIGNA Dental 1500 is one of our most popular plans, and it does include orthodontia, and that is for all ages, both child and adult orthodontia. So that's a call out there, as well as implant coverage on our CIGNA DVH 3500 plan. Now, I will caveat that by saying it's a $2,000 lifetime max, but it does provide some implant coverage, which is pretty unusual these days. And it also covers the whole implant itself. So not just the implant device, but also the crown that goes over it. So it's comprehensive coverage on that plan. And then finally, we have our dental 3000 benefits. So this is a high maximum plan. So instead of paying out the traditional 1,000 or 1,500 on the preventive or low deductible plans, this plan will pay out up to $3,000 annually after their deductible. So a lot of great options for you to layer on top of your existing client base. Okay, so I want to share some of the overarching themes across all of our plans all over the country in our 11 markets. So number one, we are in 3 state-based exchanges, Colorado, Georgia, and Virginia. We have many plan designs in our product portfolio that are built so that at the time of service, the customer has a more clear understanding of what their out-of-pocket cost is. So you will see a lot of copays on a lot of different benefits that kick in even before the deductible. Part of the reason that we built our plan designs this way is we don't want to discourage members from getting treatment that they might need. What we know is that as these plans have evolved over time and we've got really high deductibles and co-insurance types of plan designs, makes it difficult for members to know what it's really going to cost them and what their out-of-pocket expense is. And members will forego care before paying for it out of pocket. So I'll show you that when we go through the plan grids, but you'll see that that's a definite focus on our product designs for 2025 and beyond. We also have enhanced diabetes care plans available in Florida, Georgia, Indiana, Mississippi, Tennessee, Texas, and Virginia. We have those available in the bronze, silver, and gold medals, and those medal tiers do vary by state. We feel pretty fortunate that we were able to get some diabetes care plan exceptions by CMS because of the limitation of the 2 non-standard plan counts. So to have these available is a very nice offering to those that might have diabetes. From a pharmacy perspective, we have $0 to $3 copayments on our tier 1 medications in almost all of our markets. Our tier 1 is equivalent to the ACA generic required medications that have to be covered under the plans. We also have competitive drug co-payments in the metal tiers for tier 2 and 3 drugs. I mentioned that our specialty pharmacy is through Accredo, and then we also have that home delivery availability through Express Scripts. We talked a little bit about copay forward plan designs. You'll also see $0 primary care and $0 mental health benefits available on select plans in certain markets, as well as $0 virtual and $0 urgent care visits on a lot of our plans in the markets. So again, we're really trying to make sure that members get the care they need at the time that they need it. You'll also notice inpatient copays and ER visit copays, as well as lab copays, because that's always a guessing game to figure out how much it's going to cost you to go get those services. Okay, so moving on to the diabetes plan. Again, this is only available in certain markets. You'll see in the middle, the metal level offering. So in the bronze level, they have one plan in Indiana and Florida. And there are 2 metal levels in Georgia, Mississippi, Tennessee, and Texas. So in Georgia, Mississippi, and Tennessee, there's a bronze plan and a silver plan in this enhanced diabetes product. And in Texas, it's a bronze and a gold plan. In Virginia, this plan is available in all metal tiers, so lots of options for members in those specific states. This plan offers a $0 copay and deductible waived for all of their diabetes supplies, equipment, and education, and services for screenings like A1C, neuropathy, and retinal eye exams, as well as nutritional counseling and foot care. For those markets that do not have this enhanced diabetes plan, we do embed our patient assurance program across all of those markets. So this program has a flyer. There is an open enrollment resource site, which I'll show you in a few moments, where you can access that to provide to your patients or members. This will cap their out-of-pocket costs for insulin or insulin-type medications at no more than $25 for a 30-day supply. So really great offering for those that have diabetes. This is a high-level snapshot. It would be hard for us to show you all the plan grids with the limited amount of time we have, but this is a snapshot of things that we would like you to know and call out in the specific states and specific categories that we have. On the far right, you'll notice that we indicated those markets in which we're filed as an HMO or an EPO. From a referral perspective, it really doesn't change things for us. We do not require referrals to see a specialist, and we do not require members to designate a primary care physician, but it's just helpful for you to know, based on how the networks are designed, the difference between the HMO and the EPO in these particular markets. You will notice that we have expanded bronze plans in all of our markets, and we have a $0 deductible for medical in Arizona, Colorado, Florida, Georgia, Tennessee, and Virginia. So that's a really attractive plan design that's taken off in the market over the last few years. We do have 3 markets that have a health savings account plan: Colorado, Georgia, and Texas. Again, you'll notice consistency of the tier 3 drug copays in all of our markets, and then many $0 tier 1 drug copays across the markets as well. I'm going to pause here for a second, if that's okay, and just answer some of the questions coming through. The dental network is CIGNA's dental PPO network. We have both our Advantage and our Total network, and those networks vary depending on the plan. In fact, I can go back quick and show you that. Whoops. So the preventive and the bundled plans use the Advantage network, and the high annual max is the Total network. But again, it is CIGNA's dental PPO network. Question is, if I'm licensed to sell in Illinois, can I sell CIGNA in North Carolina, Indiana, and other states? Yes, that's a great question. So how CIGNA functions is we will contract you in the state in which your resident license is, and we will appoint you in any other states once you have business in hand. So if you are a resident in Illinois and you sell a policy in North Carolina, our team will internally check that off when the enrollment comes through, and they will work through appointing you in that state so that you can get credit for the sale and start to receive commissions. All of the highlights and plan grids will be posted on our Open Enrollment Resource Center, which I've already sent your team, and I'll show you a snapshot of what it looks like at the end. Are there plans to update the facility and provider searches before open enrollment? Yes. We have a go-to-market call every morning, every week to go through all of that. I believe that everything is operational for 2025. I can tell you that the summary plan descriptions and the certificates of coverage will not be live and available until October 25th. They're in testing right now. But keep an eye out for that. Your providers should be accurate for now. If there were any changes that would be affected for 2025, they will try to capture that, but you should be able to use the provider directories as they stand now. And yes, we will make sure that slides are sent to you guys, as well as on-demand trainings, which are available to you. I can show you where that lives as well. Okay, moving on. So everybody's talking about ICHRA. We feel like we should too. So what is an ICHRA? It's basically a health benefit to employers to reimburse employees tax-free for medical expenses. What does it mean for CIGNA IFP? We're well positioned to be a carrier of choice for ICHRA. We've had off-exchange ICHRA type plan designs for many years now. We just haven't really marketed them that way. And we have a pretty fair amount of ICHRA business on our book because of the nature of the fact that we are largely an employer organization. And so when employers transition to ICHRA, they're a logical choice to pick up our coverages. So we do have those products available in the marketplace today. Some of the regulatory updates that we've been monitoring over time. Number one, agent of record protection, which I'm sure you are all aware of the new CMS regulations requiring customer social security numbers to be submitted through EDE, the three-way call to verify agent of record, different things like that. Of course, we know that regulation updates are on hold because we are in an election year, so that's always kind of a challenge. So we're waiting with bated breath to see how that all shakes itself out. We know that there's a new requirement that DACA recipients can qualify for a special enrollment period to enroll in coverage. And then finally, focused on accurate coding of health risks for our members. Back to the Take Control Rewards program and asking people to complete their health assessment and get their wellness exams. It's really important when we have members who haven't sought care in the last 6 months to really go get their physical exam or engage with their benefits in some way, shape, or form. That helps us, again, start to understand them, start to engage with them, and get them the services that they need so that they don't go from a healthy situation to a chronic or catastrophic situation because they haven't been screened in a timely manner. This is a high-level network overview. One caveat that I'll make here is that it's always a best practice when you're trying to look up providers to use the CIGNA.com provider directory. That is our source of truth. We know that there are other means to look up providers via healthcare.gov or maybe Health Sherpa, but this is our source of truth. That's the most up-to-date. It's refreshed every night. If you need to validate that, that's a really good place to start. I'll also caveat that even though we're listing these larger hospital or provider systems across these markets, it's always good for you to double check to make sure that that facility or that specialist is contracted, because in some situations, we may not have the whole system contracted across our geographic footprint. The other comment that I would make in this vein is if you are selling a member on the network, it should be tied to a need for a specialist provider that might have access through these particular systems. Keep in mind that we are required under ACA to cover any emergent or urgent care as an in-network basis. So if you have a member who lives in an area where maybe that particular hospital isn't available to them, we are going to be able to cover them in an emergency situation for whatever hospital might be closest to them. So just again, high-level snapshot of some of our core providers across some of our markets. There are network guides on our Open Enrollment Resource Center that will show you a breakout at the state level and by county which hospitals are contracted in our network. So key market takeaways. We know that CIGNA is a household name, and we've got some market consistency across our core markets. Competitive commissions and bonus programs. Commission schedule just came out this week. Bonus program is still in the works, so more to share as things unfold. We are really leaning into our Take Control Rewards program with our members to help them engage with the plan, our strong provider network, and our unique plan offerings that are focused on making it better for the member to get care. Okay, a few market callouts. So I'm not even going to talk about network or brand because you'll see that theme across a lot of these particular markets. But in Illinois, there was a network expansion in Silver Cross, with Silver Cross and Rush in those two counties. So that is a network addition for us, which is great. Again, copay forward plan designs, you'll see that same thing across all these markets. There was a dual product in Illinois that was Northwestern Plus, and that has been discontinued. So if you had members that were on that plan, they should have already received a discontinuation notice and a recommendation on an alternative plan for them to evaluate during the open enrollment period. In Texas, there are two plan regions in 2025, but they both use the same Connect network. Also talking about network real quick, typically within the state, CIGNA's markets have reciprocity to shift between the two territories or multiple territories across the network, but there is not reciprocity outside of the core state. So if you have members who have kids that are in college or traveling, they are truly only covered for emergency or urgent care. There is not reciprocity across the networks because it is not an open access plan. All right, a few more call outs. So Georgia obviously has moved into a state-based exchange this year. They feel like we're going to have strong bronze product in Atlanta and strong silver and bronze products in Savannah. In Mississippi, Oceaner is now in network in the Gulf Coast, so another network addition for us there. And they believe that there's going to be competitive pricing with strong market share in most areas in Mississippi. In Tennessee, strong statewide network across 6 different rating areas. Vanderbilt and Methodist are both in network as well as Ascension. Tennessee should be a good market for us this year. And we'll know more about pricing in the next couple of weeks, you guys. Some of these states are a little bit slow to get their pricing out, so we're still waiting on some market share intel. All right, so let's talk about CIGNAforbrokers.com. This is where you guys will go in to look at your book of business, and I'm going to show you some really great enhancements that we made in a moment. But you guys will have access to all of that in your broker portal, as well as our quote and enroll tools. For dental, it's Express app. For medical, we use a white label of Health Sherpa. Keep in mind that this is only going to show you CIGNA product if you click in through CIGNA for Brokers, but you can quote both on and off exchange through Health Sherpa, with the exception of the state-based exchanges. You can quote Health Sherpa off exchange for Colorado, Georgia, and Virginia. However, Colorado option plans must be enrolled via Connect for Health Colorado or the state-based exchange. All right, so we know that we've had to work on our tech. Sometimes our tech is a little bit lagging. It kind of happens sometimes with a large organization, but we are happy to announce that we have been working on this improvement for a number of years and it is finally available. You can actually make a payment on behalf of your client in the CIGNA for Broker portal. Oops, let me go back. So essentially what's going to happen is there will be improved book of business filters. There will be flags on your members once they flow down through the file feeds from healthcare.gov. And you'll be able to see who's in jeopardy of not making their binder payment, etc. Well, a couple of caveats with the broker payment feature. So you can make a payment on behalf of your customer, but it is a one-time payment. You cannot set up recurrence yet. They're still working on that. That's probably update 2.0. But you do have that ability, and you'll be able to see where they're at on the renewal perspective as well. So great enhancement for us next year, bringing us more up to parity with the market. Okay, this is the Open Enrollment Resource Center. This is your ungated, everything you need to know, links to everything, provider directory, formulary, dental resource center, everything you can think of is in this catch-all. We build this site every year for open enrollment, so you'll have access to it again for 2025. Think about the For Brokers page as sales tools for you, materials and resources to learn more about the medical plans, to educate yourself about plan grids, network, all of that kind of stuff. Think about the Share with Clients tab as client marketing materials. So flyers that you can download and give to your clients that explain the patient assurance program, that explain Take Control rewards, explain how to use and log into my CIGNA. And then also there are some high-level education materials that are kind of ACA 101. Glossary of terms and definitions, what do subsidies mean and how do they apply to me? So a lot of resources available for you there. There is also the training resource tab, which is all of the on-demand learning resources. In fact, this presentation that I'm giving you today has already been recorded and it is out there on demand for you, both in English and in Spanish. So you can feel free to go back to those tools at any point and get more detail. If you want to look at a state specifically, every state is recorded there too. So if you want to know more about maybe Mississippi, you can go out and watch the on-demand training for Mississippi. And then the last thing that I'll mention here is our pre-crafted templates. So what we built were basically email communications that kind of echo how we would communicate with a member, but we know that they don't necessarily read our mail or read our emails, but we know that you're their trusted advisor. So these are things like reminding them of signing up for my CIGNA. Have they signed up for Take Control rewards? It's a way for you to continue to engage them post-sale and kind of echo our sentiment from you as their trusted advisor. So lots of great resources for you guys in the Open Enrollment Resource Center. I want to walk through a little bit of the customer journey because I think that this is really important and every issuer does things slightly different. At CIGNA, when the enrollment comes through, a welcome email will be sent to the member within 2 to 3 days of the time that the enrollment is received. It will be a welcome email and a reminder for them to submit their binder payment. ID cards and flow of information for eligibility purposes and all other things does not occur until the binder payment is made. So keep that in mind, that the binder is the trigger for everything to start to flow. So member ID cards won't start to generate until after the binder payment is made, and they will be mailed about 7 to 10 business days after that. Keep in mind as well that they won't be able to access their digital ID card through MyCIGNA also until the binder payment is made. So if you guys get in a situation where you have a member who is enrolled and maybe they got an appointment that was really close, to their effective date, just reach out to our team. We're happy to pull down an ID number for you and get it to your member so that they can give that to their provider to help them with their point of service. They will then get an email communication about setting up their MyCIGNA account, how to use it. They'll get a quick start guide about how to use their plan. After that, then they'll get a reminder to go paperless through their billing dashboard on mycigna.com, another reminder about the Take Control rewards program, and then finally, they'll get a notification about how to explore their care options, how to find providers through either mycigna.com or the MyCIGNA app. Few reminders about enrollment dates. If it's a 1/1/25 effective date, they need to be enrolled between November 1st and December 15th. For a February 1st effective date, they need to be enrolled between December 16th and January 15th. Some reminders about billing and enrollment. Obviously, now you guys have an enhancement where you can help support your members and make their payments, but we do have a web link that is sent. That's what's sent to the members when we send their welcome email, thecigna.com/IFP-payment, so they can make their payment there. Auto payments are EFT banking info. They can use a credit card to make a one-time payment or make a binder payment. They can also save that credit card information in mycigna.com under their MyBill portal so that they can make those payments via credit card. There's also a telephonic option, and that is an automated service. But that is not just available to your members, but you can actually call on behalf of your member as well to help facilitate that payment. Reminder on the on exchange, the initial binder payment is due until the effective date or up to 30 calendar days after the app date. So the app date is the most pivotal phrase in that paragraph. So if I submitted an application on the 10th, I have 30 days or that after that application date to submit that binder. Renewal app payment due dates are December 31st for January 2025 and January 31st for February 2025. Ongoing monthly payments, the due date is the day before the coverage period begins. So for example, it would be January 31st for a February coverage month. And then when it comes to recurring bank drafts, the EFT draft on exchange occurs the day before the due date of the invoice. All right. And then lastly, this is your broker management team. So obviously you always have access to me, but we do have people across the whole country that are dedicated in specific regions and specific states. So if you ever had a question about something network related in Florida, you could reach out to Dennis. If you needed more information on why Tennessee is going to be a good market for us this year, you can reach out to Packy. But of course, you can always get in touch with me as well. Here are our contacts. And again, this is all of these quick links for the payment, broker portal, drug list providers, everything is on our Open Enrollment Resource Center. You do have access again to that broker support team in addition to our team in the field to be able to answer any questions that you might have. All right, and with that, I'm going to answer some of these questions. I have a question about macular degeneration. We would need to look at the certificate of coverage to confirm how that is actually covered. I'm sure it requires prior authorization. One recommendation I would make is that if you do go to CIGNA.com and get to the plan document section, best practice for me is to look at the certificate of coverage and do a control F and do a lookup. It's going to tell you whether it's covered or what the exclusion is on it. The summary benefits are the government document, and they're really hard to analyze what's really covered. And if you had a specific question like this and you can't get what you need by looking at the certificates, please reach out to my team. Excuse me. Please reach out to my team because we have internal resources who can help us determine the coverage position and get you the correct answer for your member. Question about agent of record. I'm glad you brought this up. So at CIGNA, agent of record is we have already had a locked process. We have not changed our process. Our process has been locked for many, many years. So essentially, part of the producer agreement has a clause that says that the original application that comes in for that member and the agent that is attached to it will remain until such a time as we are instructed to change that agent of record via an agent of record form or file validation from CMS. To date, we do not process file changes. So if you took over an agent of record during a renewal period, you would need to let one of my team know so that we can, number one, validate the file connection and see that you are listed as the last in broker of record, and then we can make that manual update. If we don't see you on the file, we're going to ask you for an agent of record form that's also signed off on by the customer. We do not have public facing slides because these are proprietary slides. You can always direct them to our public facing website to get them the information that they need, but we do not provide slides for recording. Okay, this is another contracting question. So if you are affiliated with another agency and you want to be aligned with HPS, you need to send an email to our team and we will look up your record and see what the affiliation is. We will need your NPN in order to do so. And if we need to make adjustments to your contract profile, we can help facilitate that for you. Sorry, guys, I should have left that up for you instead of the thank you slides. So there you go. IFP is individual and family plans. And yes, I believe that this session is being recorded. So all of this information lives on our Open Enrollment Resource Center. There's PDFs of all of the information that you'll need to support your clients. What other questions do you guys have?
Sheila, thank you so much for this. This is a plethora of knowledge. It's been very informative. We really appreciate you.
Yeah, no problem. That's my job. That's what I'm here for.
I can tell. If you ever find yourself out here in Chicago again, like you were in June, do look me up and we will make sure you do not go home with an empty stomach.
Yeah, I love it. Thanks, guys. Oh, I think I saw something else come through.
There we go. Super helpful. I agree.
Thank you. Yeah, and I would encourage you really dig into the resource center. I mean, our team does a great job of, putting everything that you need out there. And I am a big advocate for ungated resources. We don't have anything to hide. This is all public information. So we, over the last couple of years, have really worked to build out the Open Enrollment Resource Center so that you guys have all of the tools that you need without having to log into CIGNA for Brokers. There are additional tools out there for you guys too, but I would steer you more towards the resource center if you ever need something.
Yes, transparency is key in this industry, and that's something our agents love.
Yeah.
How do we access the resource center?
Let me here, I'm gonna just stop sharing real quick and I'll just I'll just throw it in the chat.
Gotcha.
Oops.
And again, I
And
saw
at
some of you
some,
folks. Oh, go ahead.
I was just gonna say at some point, once the commission and bonus flyers are finalized, that will all be out there as well.
And we'll probably put them in our CRM as well.
Yeah.
And for the folks that are raising their hands during the presentation, just use the Q&A box for any questions, and we'll get those answers. As you can tell, Sheila was on it. But other than that, if nobody has any questions, I do believe we can let you go.
Oh, I think that only comes to you if I
What is
put
it?
that link in there.
Cool. I'll go ahead and blast it to everybody.
Okay,
Thank you for
cool.
that. Let's do that really quick, everyone. In the chat box, there is the portal, so you should be good.
Any other questions, guys? Well, all of our contact information lives on that site. You can click on the broker team. You can find any of us. We're just an email or a phone call away, anything you need.
Thanks again. I really appreciate you, Sheila.
You're welcome. You guys have a great day. Happy selling.
Yes. Everybody, we will have another presenter coming up soon. I will go ahead and put some tunes on until we get situated, and hang tight.
Thanks, guys.
Also, again, thank you so much to the team for having us here today. Really looking forward to this open enrollment. I know there's been a lot of adjustments with Medicare and a few other things. Many of you folks are, I'm sure, affected by the hurricane, so deeply apologetic and thinking of everyone affected. But we do have some things to look forward to going into open enrollment, and I'm here to share that from Oscar. We'll go through a little bit of a sort of corporate update from our side about Oscar, some new products, announcements, adjustments to the broker portal, some member experience updates as well. And then we'll just briefly go into any 2025 expansion and service area spotlights where we feel like we'll be really competitive. We'll also make sure that before open enrollment, we'll send out heat maps as well to leadership and to the team as well. So you'll know exactly where Oscar's looking most attractive and most competitive as well. And we should have those out in hopefully the next week or so. And of course, any questions I'll be saying on at the end. Shouldn't take more than around 20 minutes on the presentation itself. For those of you who I don't know, my name is Jared Wassley. I'm a sales lead here at Oscar. I've been here for around 6 years. Um, was on the small group side, have been on the IFP side for the last 4 years. Take care of our national partners, but I particularly focus on individual for Georgia, Tennessee, North Carolina, Ohio as well. So happy to be presenting today. So let's go into a little bit of about Oscar, kind of as a refresher. What have we been doing over the last 12 months when we last spoke? Overall, our mission has not changed. We exist to make a healthier life accessible, affordable for all, and particularly for our members. We really are the only large carrier that's ACA specific, and we feel that's a huge advantage compared to other competitors who might have, distractions from small group or large group or Medicare business. We really just focus on the one kind of key part of our portfolio, and we think that this makes a real difference. And we'll go into some metrics why we've been so successful. As a reminder, we've had more than 10 years of open enrollments. So this will be our 11th open enrollment as a company. We were founded in 2012. Our first market was New York in 2014. In 2015, 2016 was a real key year for us. We really doubled down on our member experience. We created our care team model that we still use today, and we've scaled. 2021, we went public on the New York Stock Exchange. We were in our existing footprint as well, which is 18 states, and had the most successful 6 months of the company. We have achieved total company adjusted EBITDA for the first half of 2024, and we're looking forward to continuing that success going into 2025 with the help of everyone on the call. So thank you all for that growth. Speaking of growth, we're now at 1.6 million members. When I presented last year to most of you folks, it was probably closer to 1.1 or 1.2 million. So really strong open enrollment, strong SEP as well. In actual fact, 1 in 14 individuals on the ACA has an Oscar plan. So we're a major player in the ACA. I believe we're in the top 3 or top 4 in the total market. In our 18 states, very much looking like a national player. And 504 counties. You remember last year we largely did county area expansion within our existing network and our markets, and you'll see something similar from us this year too. One thing that we'll always talk about is our NPS score from members. So our member NPS score is 66. Now, what is an NPS score? You might not hear that much in the healthcare space. And frankly, that's because other carriers have a really poor NPS scores. Theirs usually hover around, some even have a -1 or 2 score, or they might be 5 or 12, depending on the company. These are available. You can search these. But these are often used with consumer brands. So something like Apple has an NPS score of 70. And essentially, it shows whether or not members, your existing clients, are ambassadors of your brand. So basically, it takes promoters, removes detractors, and kind of gives you a scoring based on how much do members like the product, do they trust the product? And this is actually something that we're incredibly proud of because, as I mentioned, our growth going towards 1.6 million members, our NPS scores actually increased from around in the 40s about a year or two ago to 66. So as we've scaled, our NPS score, our member experience has actually grown as well. So I think that's something to be really, really thankful for. And the other thing is, this directly links to member retention. So we have over 80% member retention nationally, and we look to improve that metric year on year whenever we come around to renewal time. And as I mentioned, we'll go through a few things during today's presentation, but really focusing on working with members, focusing on what they need. So we have a Spanish first experience that we're launching in Georgia that we'll talk through. We have an innovative HMO product that we're launching in a few select states. We've enhanced the broker tools. We have ICRA-specific portfolios as well in some states too. So let's go into those new products and those new announcements. So the first thing is we're launching new HMO plans. So it's a gate cap HMO plan across the Texas markets. Also a plug, there's also an HMO plan specific to Georgia and DeKalb County only. These are over and above the existing network. So we're not changing the network, we're adding to it, and it allows us to add affordability options for members in those existing areas. We'll speak through a little bit more of that when we go state specific. And then we also have a best-in-class Spanish-led experience. So we launched this about 2-3 years ago. We call it our Oscar experience. So the full kind of member experience as we kind of speak through this presentation is also available for Spanish members. So that's a Spanish-speaking care team, collateral. The app is fully translated into Spanish as well. We'll also go through some broker portal updates that we've been able to add some additional visibility, downline management that's more for leadership, but we're continuing to update and improve the broker portal. So with these HMO plans in mind, if you ever see guided care, this will be for Texas and for DeKalb County in Georgia, that is our new HMO product. So essentially, it reduces a common HMO pain point. It's a much more streamlined referral process that's really quick. And there's also a referral status transparency as well. So not only do members have the cost saving of an HMO, but they have a lot more kind of user-friendly experience in terms of selecting their PCP, and then actually gaining access for a referral. The other thing is that we're launching our Buena Salud product. So this will be on and off exchange in Georgia and off exchange only in Florida. And basically what we've done is we've taken our normal Spanish-speaking experience and have built on that and developed this Spanish-speaking plan. So it essentially takes the Silver Standard plan and now defaults the experience to Spanish. So, example, when somebody enrolls into their plan, they will automatically be defaulted to the app in Spanish. When they search for providers, that will default to Spanish. So, really great option that we're able to have, particularly on exchange in Georgia, I think is where we're going to see the most interest in this, and excited to bring this out to market. And then the other thing as well is around enrollment platform updates. Might not be eligible for the folks on this call, but just kind of as a reminder, we do have direct EDE enrollment through our portal. We did not sign an extension agreement with Health Sherpa, but there's a ton of other options through the enrollment. So happy to go through any Q&A at the end of that, but we also have the Oscar portal itself, which you can continue to use for renewals and for new business directly on and off exchange. So let's go into member experience. I spoke through NPS score, how we're proud of it. How do we actually build a great member experience? So firstly, it's all linked around the Oscar app. Now, I understand every carrier has an app, right? But we have built the app ourselves. It's built internally. We didn't white label anything on the app side. And so we were able to customize it and build it according to how we want the member to have that experience. Not only that, the app also gives you access to virtual urgent care, which is our version of telemedicine, where you can essentially connect with a provider in under 15 minutes and have prescriptions sent to you or renewed, or even just sent to your local pharmacy as well. As an add-on to that, we also launched virtual primary care. Now, this is available in a few select markets. So we have it in Florida, we have it in Georgia. And essentially, this takes virtual urgent care and expands upon it. And these are actually Oscar doctors. They're under Oscar Medical Group. So it's not like we farm out, like other carriers would farm out these members to a third-party system where they don't know your background information. They don't have any medical records. So you're basically speaking to a stranger whenever you go through this process. With Oscar's virtual primary care, this is a dedicated team under Oscar hierarchy that can view your claims, view your back-end story, view your medical records, and be able to assist you like a regular PCP would. And finally, we also have our care team. They're based in our hub in Tempe, Arizona, and that's members kind of day-to-day support for help with claims, questions about helping find providers, and other kind of member-specific questions that they might have. We're also really big on member engagement, if you couldn't tell. So one of the reasons why that is we believe that they benefit since they're enhancing their experience. They're getting to basically gain all of the features that we're able to offer. But we also believe that the agents and agencies earn more because these members tend to stick with carriers longer. They're much more engaged. They understand the ins and outs of their products. So making sure that when we're enrolling, we aren't just enrolling them. We're ensuring that they know how to create an account. Setting up auto pay, that's a huge flag in terms of them having a term risk later on. And having that account also gives them really easy access to be able to download the app. That's where they can access that virtual PCP, that care team messaging, and all those types of things. Well, what about the broker experience? Well, one of the things that we've added to our broker portal is a dashboard look. So now when you go on, you'll actually see which payments are overdue. Can I schedule an email to those clients? And then also maybe you have a very high percentage of folks with auto pay turned off, should I say. That would obviously be a big flag. We want to always push for auto pay if possible. Folks forget about payments. We all lead busy lives. This kind of reduces that friction for members falling off unnecessarily. And then what you'll also see is once we go live with the renewals, your at-risk renewals will ping up, and that we have kind of an internal metric around how we decide who is an at-risk renewal or not. And then from an appointment point of view, won't go through the whole process, but if you aren't appointed yet, please make sure you are appointed and you have the correct hierarchy selected. Reach out to me directly and your leadership if you have any questions on this. We want to make sure that your appointments are squared away well before open enrollment. Once you start open enrollment, it's much more difficult for us to make adjustments. And if you aren't appointed and you write business, you just create an online account, you won't be paid commissions on those. So very, very important call out. We make sure that our agency, our GA is selected correctly, and then that we are ready to sell. And finally, Oscar's really taken a strong step in valuing the integrity of your enrollments and our book of business. So we've frankly have a zero tolerance policy to enrollment fraud. We've seen CMS have come out with new messaging as well. And so we think it's incumbent on all broker partners to have responsible lead generation. Client consent is obviously the name of the game. We know your leadership's worked really, really hard on developing these on the back end for you guys. So you should be all squared away here, but always important for us to mention that we do have an internal team that looks into investigations. We've termed a number of bad actors across multiple states. So we're also kind of doing our part as well to make sure that our industry stays as clean as possible as well. And finally, it's not just me. So I'm, of course, the rep for VeloPoint and the other subsidiaries. But it's not just me from a service perspective. We have a full broker support team, again, in our hub in Tempe, Arizona. And the brokers at highoscar.com will kind of be any go-to for kind of day-to-day questions or issues you might have. And then we also have the 855 number for any kind of urgent or more urgent issues that come up. So let's go into 2025 expansion and look at what we're doing. So as I mentioned, we aren't adding any new states, so we're staying within the same 18 states, but we are expanding similar to last year into new counties. So we're adding 59 new counties. So while I have the map up just visually, I think it's helpful. So we're adding just a single county in Texas, which we'll go through. We have some rural expansion in Oklahoma, and then you'll see some more rural expansion also in Michigan and in our existing service area in Ohio. Our really kind of large metro or addressable live impact for expansion is that into New Jersey. So we've been in New Jersey for probably the last 8 years, but we're expanding into the full statewide. So we're adding Southern New Jersey to the fold. We're also expanding into Charlotte, North Carolina, as well as Winston-Salem. So we have a number of expansion efforts there and probably the largest market growth that we're looking for this year. And then in Georgia, which has been a pretty strong market for us overall, we're adding the counties around and including Macon, Georgia, and east into Augusta as well. So really excited for that. And we'll break this down in a few selected states that we've gone through. From a naming plan sort of suite, obviously this is another year where we have reductions in plan choice. So remember the NBPP adjustments started last year, where we went down to a max of 4 plans and 1 standard. Now we basically are only allowed two plans and 1 standard per metal tier. One important caveat that we'll touch on later on is, especially on the silver side, condition-specific plans do not count towards that total. So you might see in some markets we have like 4 or 5 silver plans. That's usually because we've either have or we added a diabetic plan or a condition-specific chronic care management plan that we'll go into. Overall, though, I think our plan naming is pretty straightforward and simple. Standard plans are obviously the basic CMS mandated design, the same across carriers. Simple plans are our lowest premium, slightly more lean design, but usually the lowest cost too. Classic is kind of the middle of the road plan. And then when you see an elite plan, we'll usually have one, maybe two, either in silver or bronze. And this is often our richest plan. So think copay plans, even at a bronze level. So I mentioned condition specific plans becoming more important. So CMS has actually allowed Oscar to add a number of condition specific plans across a number of states. So we launched the diabetes plan about 2 years ago. That's available in a number of states. And then we also launched the Breathe Easy COPD plan last year in Arizona and Tennessee. We now have that in Oklahoma as well. And then you'll see chronic care plans in some other states. So this is often where we don't have a diabetes plan. And in some states, we might actually have it in addition to. So I'll briefly just go over the differences. So COPD plan, obviously for folks who have pulmonary issues, $0 PCPs, $0 behavioral health. And then there's specific pulmonary rehab aspects that are at no price as well. There's kind of a similarity between the three as well. So for example, you'll see $0 PCP and behavioral health across all three plan types. Of course, for diabetes, this is very much specific to folks who are managing chronic diabetes. We believe that members can save around 25% of their out-of-pocket moving to a diabetic plan. And they also include $0 labs, $0 eye and foot exams as well. And then we have an insulin cap, a monthly cap on it. So even though there's many affordable options, there's actually a $0 insulin on this plan. Let's say they have to take a tier 3 or tier 4 insulin that's very expensive, that would still be capped at $100. And then finally, the chronic care plans, well, in these 5 states, these are kind of an add-on from the diabetic plan. So these are folks who have, maybe multi-condition. So it basically takes the diabetic plan, adds pulmonary and cardiologist benefits. So for example, there's a $0 specialist copay for endocrinologists, pulmonologists, and cardiologists, but then still keeps the $0 PCP, $0 diabetic labs, an insulin cap, and those types of things. So kind of think of it as kind of going richer as we go right across the screen there as well. So very, very grateful that we're able to add these condition-specific plans, which offer a slightly more tailored approach for many members. So just want everyone aware of these as we go into open enrollment. So let's go into kind of regional expansion, and I'll touch a little bit on the expected competitiveness. And of course, we'll also offer those heat maps which will be a little bit more in-depth than what I'll go into today. So Florida, there's no state area expansion there overall. We're in pretty much across all the major metros of Florida. And this is a statewide network. So whether if you were living in, let's say, Daytona Beach, for example, you can access the Jacksonville hospital systems if you need to do that. Same for Southern Florida. If you're in Broward, you can go to Miami-Dade for the systems there and vice versa. So you can obviously see there's quite a bit of structure to a large service area overall. We have virtual primary care in Florida as well, and that's at $0 as well. So really great option there for affordability. Of course, there's discontinued plans. I won't really go through too much of that, but just as a reminder, just want to plug, I believe in South Florida, we're looking very competitive as well as Orlando as well. So again, we'll have those heat maps ready for you, but those are the 2 areas where we look most attractive. Palm Beach County in particular, I think is worth a special mention. We're very excited for this prospect for further growth in Florida this year. Tennessee is another market that we think is also ripe for expansion too. There's relatively lower brokered lives in the state, and that's probably just a local dynamic where many of the local brokers have moved more towards small group and large group efforts. But we will be incredibly competitive next year. So what you see on the western side of Tennessee, that's the Memphis area around Shelby County. So we expect it to be lowest cost bronze and lowest cost silver in that metro. And then in the Nashville metro, which we expanded considerably last year, that section in green is all the expansion from last year. We also will be expected to be lowest cost silver and bronze. Really strong network play in Nashville in particular. United and CIGNA are losing HCA as a hospital system in Nashville next year. So those members will need to find a new home that has HCA in network. We have HCA in network. We have Ascension in network, and we actually added Vanderbilt as well about 18 months ago as well. So really strong offering in Nashville, and we're really expecting to do incredibly well there. Georgia, as I mentioned, we have the same existing market overall, but we are adding some expansion. So we're adding, the smaller Murray County in the north of the existing section, but we are adding Macon and Augusta as new service areas. So Macon, that's around the Atrium system that we have a good relationship with. And in Augusta, that's an extension of the Wellstar system. So overall, again, as a reminder, our main network has not changed. It's Emory, Northside, and Wellstar within Metro Atlanta, and then south into Columbus, Georgia. And then we're adding another network in DeKalb County only. So that's just with Emory. It's what we call, again, our guided care plan. So that'll be available to all members living in DeKalb County. From a competitiveness point of view, we won't be lowest cost silver next year in Georgia, except for DeKalb County, but we will keep pretty standard kind of price increases overall. So there won't be huge shocks to any of your existing book in Georgia overall. Many of the more affordable options, particularly in Atlanta, will be very, very narrow network options. So there really isn't anything that compares from regard to a network breadth point of view. And then let's also talk through North Carolina. So expanding with Atrium in Macon and also in the Charlotte metro and Winston-Salem area too. So we're expecting to be pretty competitive, very tight pricing overall. We will have a lot of $0 bronze here, which is a pretty strong market for bronze in North Carolina. And then there'll be a really tight pricing on the silver side, also expecting quite a bit of expansion here as well. It will actually be a co-branded network with Atrium. And so we're very excited to be able to have that. And we'll have some $0 silver in some of the western parts of our service area. From the central and west region, Texas, obviously a massive market for all of us. We're only adding one county, Hidalgo County, but we've been in Texas again now for probably 7 years. So we've been in all of these metros for some time. We're expecting to be most competitive in San Antonio and El Paso. So in San Antonio, two very large counties. So we work with Methodist and Baptist health systems. This is one of those areas where we are also adding this HMO guided care option too. So if folks really want the most affordable option, they can have the Baptist only health system, which is pretty comprehensive. And then they can still have the regular EPO non-referral network, including Methodist in San Antonio. And then El Paso as well. So very large county, very competitive for us next year as well. Another one of those where we have an HMO and an EPO option. So the existing is with Las Palmas and Providence. Now you'll also have the more affordable option of just having Providence if folks just need that system and really want to maximize the cost savings there from a premium standpoint. In Ohio, as I mentioned, largely just rural expansion. So very important point here. These are two separate networks or even markets. So in Northeast Ohio, this is our joint venture with Cleveland Clinic. Quite a very robust network. Also quite expensive too, as well, to be quite frank. So, that's definitely someone who has to access the CCF market. That's probably why you won't see a ton of new renewals in Northeast Ohio. And you have to live within one of these counties to access the system. And we're adding Holmes, Carroll, and Harrison. Now, Central and Southwest Ohio, that's a separate market. So there is no interchanging of market here. It's the only state where we have this particular business type. And that's just because we have such a different arrangement in Northeast Ohio. So Columbus and Cincinnati, which we launched into last year, still very, very, very strong markets for us, adding 6 rural expansion counties. So really strong pricing for us in Central Ohio. We're expecting lowest cost bronze and silver in almost all of our Columbus rating area. And then kind of middle of the road pricing for Cincinnati, really flat. I think most of the requested rates there are only 1 or 2% increases in Cincinnati. So really kind of flat market there overall. So good stability for most of your members. And that is all we have from an expansion point of view. Happy to go into any specific states at the end if we need to. But just, we want to just thank everyone also for attending this, taking the time, growing with us. We believe we offer best-in-class broker support, great broker tooling, and again, we specialize in the ACA and IFP, and we really continue to invest in it as well. So we've been in the market for over 10 years. We aren't really a new player anymore. And we have a great record of customer satisfaction. That high NPS score of 66, members really do love and want to keep their Oscar plan. So we're really, really proud of that too. These are my details here, jwasley@highoscar.com. Please feel free to reach out directly if you have any specific questions. And obviously we can take any Q&A as well. So thank you so much. And that's all that we have time for, I believe.
Jared, if you pop in the Q&A there, you should be able to see questions.
Great. Let me open that up. Okay, so good question here. If I'm licensed to sell Oscar in Illinois, can I sell in North Carolina and other states? You, of course, will need to be licensed in every state that you sell in, and you'll need to get appointed in every state that you sell in as well. So basically, what I always tell brokers is before open enrollment, so before you start to sell plans, make sure you're appointed in all the states that you anticipate selling products in. We use a ready-to-sell type approach. So it, basically you become active once your first policy goes in. So there's really no harm in, if you licensed in 10 states, just get appointed in all 10 states. And then let's say, for example, you weren't expecting any business from, let's say, Texas, but you suddenly get someone. Please make sure you go and get appointed in Texas. Let that process in the 20, 30 minutes it takes, give or take. Not from your side, it will only take you 5 minutes, but it'll probably go live in about 30 minutes, and then write your policy. So just kind of an important caveat there. Question here on Sherpa. Yes, we will. So we don't have an agreement with Health Sherpa. That basically loses the EDE component of it. So direct enrollment. So we will be on Health Sherpa. You'll see us. You'll be able to quote us. But when you do go to enroll us, it'll have a double redirect. So not the greatest experience there overall, but again, you can still utilize that flow. And again, everything is also available on our broker portal. So if you're selling in a state in particular that that we're very competitive, my recommendation is to go on and just enroll them directly onto the portal. The number for broker support, that's 855-672-2788. So broker support, the number is 855-672-2788. It's actually the main number on our website. It starts the phone tree into broker support. I see that. Is there a plan to add Oscar in Mississippi and South Carolina? Not just yet. You can kind of see us becoming a little bit more involved in the Mid-Atlantic. So possible that South Carolina could happen at some stage. Mississippi could as well. But anything that happens there, we'll obviously let you folks know a little bit longer. Someone wants to see the contact slides again. Let me just pull that up for you. Give me 1 second for that. Someone asked for PDFs of all the information. Yes, everything is available on our website in regard to network plan grids. Those are already live. We do this state by state, so I highly recommend having on highasa.com/brokers, or if you go to the brokers page, it'll take you straight through there. I see a question here. I didn't realize that Oscar's been in the market this long. I ask clients if they've ever heard of Oscar. Some say no. Um, how do I have a rebuttal against this? I think honestly, just saying that we're publicly traded, we've been around for 10 years. We aren't in the Medicare space, and so that's all the small group space, and that's probably why people don't see us because those are kind of the big drivers of commercials, especially this time of year. So you're going to see a Humana or a Cigna ad or something like that. And that's I would kind of just direct them to we focus on the ACA. And that's probably why, we fly under the radar for the average consumer. And we also only tend to pay for ads in select markets as well. And we're a much smaller company too, so we have to be a little bit more strategic. See, there's a question around minimums. So yes, we implemented minimums last year. So you need 10 or more clients in Georgia or Florida to get paid on those. Those are the only states where those are in play. And then also there's an overall number. So no matter what, let's say you have a number of lives all over the place, as long as it's above 25, you will get paid. But again, the only state-specific ones are Florida and Georgia. I see the appointment question. I will put up the slide for appointments. Give me 1 second. So you should see the slide here. You need to go to business.highoscar.com, and that's basically to get appointed. If you have any questions, ask your leadership as well, and we can direct you in the correct way to do it. Anything else?
Jared, if you want to tell me that phone number, I can type it in for everybody.
Yeah, sure. 855-672-2788. This is actually a really good question. So thank you for this question, Chanel. So she asks, all your plans are EPOs not needing referrals or to pick a PCP, but after signing clients up, helping make payment, have asked about picking a PCP. I shouldn't have to do this correctly. The new HMOs will need PCP and referral. Okay, that's a great question. So yes, all the existing markets, we keep an EPO. There's no referrals whatsoever ever needed. What you will see though is we do ask for folks to choose a PCP because we want members to have a PCP in mind to go to if they need to. So it's not a requirement, but we do actually highly suggest that folks complete that step. And even if they're just picking a PCP that's close to them, or if they look for one that they already use, I would recommend doing that. Now, separately on the new HMO plans that are specific to San Antonio, El Paso, and the one county in Georgia, those are over and above the existing network, and those do need a PCP selection and referral process. I see a question here around, are we competitive in Arizona this year? I would say, honestly, not incredibly competitive. We do look pretty good in Maricopa County. So that looks quite good overall. We will have $0 bronze. We won't have any $0 silver. So I think we fourth or fifth lowest ranked for silver and similar to that on the bronze side. So we're expecting $0 bronze, but not crazy competitive in Arizona, but still pretty good. Anything else? And I really appreciate the questions. I appreciate it helps me kind of zone in on what I need to answer. Again, we'll also have the heat maps in the next week or so. We'll send them out to your leadership, and they will send that out to you guys as well. And that will just be a really nice quick cheat sheet of, okay, is someone at 220% of the FPL level? Okay, great. Well, then they have $0 bronze, or they might even have $20 for a silver plan. So I think those are we used a little bit of those last year. We'll utilize that a little bit more this year too. If that's all, thank you so much. Really appreciate the attention. Hope we answered some questions. And again, feel free to reach out to us if you have any follow-ups.
Thank you so much, Jared. That was incredibly thorough. We really appreciate your time, and hopefully we get some sales out there for you.
For sure. I have no doubt that you guys will. So thank you so much. I know it's a lot of information, but feel free to reach out if anything wasn't clear.
Excellent. You guys have the number in the chat. Thank you, Jared. We'll be moving along here. I'm going to go ahead and mute myself and throw some tunes on, and more towards the top of the hour, we will have another presenter. Stand by.
2 questions, and we can answer this in open forum later. Can anybody identify that lighthouse in the background picture? Number 1, what lighthouse is that? Where is it located? And number 2, what kind of boat is this? What are they out catching? So we'll talk about this in the open forum, but this is a North Carolina. I'll give you a little clue. It's a North Carolina picture. So it's a real picture I took when I was out fishing one day. So identify the lighthouse if you can, if you know where it's located, and what is this boat out fishing for? All right, so let's get started. So I'd like to welcome you to our IFP ACA kickoff event for the upcoming 2025 ACA open enrollment. My name is Todd Passer, and I'm the agency manager for North and South Carolina. And I know you guys are a national FMO. I manage the relationship for healthcare solutions team, but my expertise specifically is for North and South Carolina. So I'm going to do my best to address our ACA IFP kind of on a national level. But I'm going to share some information with you all kind of at the end of the presentation. I can facilitate some contact information to our other state-specific agency managers. So if you have questions, concerns on a specific state like Florida, Alabama, Ohio, I can make sure that I get you connected with our agency manager in those respective states. So again, thanks for taking time out of your busy schedule to participate in this presentation. We'll go ahead and kind of get started. So what I wanted to share with you at a high level is what's going on with United Healthcare's IFP ACA on a national level. We do have some market expansion. We've got some agent enhancements. So we'll kind of dive into that at a higher level. So the good news is 13 of our existing states will have an expanded footprint for 2025. We're going to be adding 119 total new counties throughout our entire footprint. And we estimate a potential enrollment of approximately 450,000 potential new ACA members throughout our expansion states and counties. So hopefully that'll happen, but those are just some predictions that our number crunchers have made internally. So what we look like on a national level, and I'm going to take a minute to let you all kind of soak this in. The shaded yellow are going to be our 4 new entry states for 2025. That is Indiana, Nebraska, Iowa, and Wyoming. So with the inclusion of those 4 new states in 2025, we'll be at 30 total states, 147 what we call markets, and over 1,200 counties throughout our national footprint. So again, the exciting news there, the takeaway is 4 new states: Indiana, Nebraska, Iowa, and Wyoming. If you plan to sell in any of those states, I'll make sure you have my contact information at the end of this presentation. I can link you up with the agency manager that manages each of those respective states if you want more information about what's going on there in particular. So we talked a little bit about, one of our key strategies in addition to adding new states is expansion or expanding within our current footprint as well. As such, we're adding 119 counties across 13 states. So again, I'll give you a couple seconds to kind of digest this. So we've broken down the state, how many new counties are going to be added in that state, and the general geographic area where that addition is going to be made. So me personally, North Carolina, we're only adding 1 county. That's Alamance County. For South Carolina, we're adding 13 new counties. Missouri, as you can see there, a ton of expansion. So again, a lot going on with regards not only to those 4 new states, but additional counties within our ACA footprint. And again, to reiterate, if you have specific questions on a state, I can facilitate an introduction to that agency manager. Boots on the ground, they can really get you up to speed as to what's going on there. All right. So this slide represents some of our national statistics on medal level enrollment, product family enrollment, and member age. So you can see about 45% of our consumers are purchasing a bronze plan, with the rest of those almost evenly split between silver and gold. Product family enrollment, our recently launched Copay Focus family of products, was very successful, as noted, with 34% of our enrollment is in that product family, the Copay Focus. And lastly, our member age stats are noted on the last pie chart. So again, majority of enrollment in that 30 to 49-year-old age bracket, followed by the 50 to 64, followed by the 18 to 29-year-olds. So again, just some interesting statistics about United on a national level. So we've also made nationally some enhancements, and a lot of those enhancements are on our Jarvis, our agent portal. So hopefully you all are familiar with Jarvis. You have used Jarvis. Man, just about everything that's important to you all is located on our agent portal, Jarvis. So a couple things we'll be talking about. We have a new homepage that's easier to navigate. Our toolkit has been replaced with the new sales and marketing page. We've also built out our Spanish language support within our producer help desk, and we'll go into some greater detail later in the presentation about these enhancements. And we've also done some enriching and adjusting on our coverage nationwide, specifically behavioral health, diabetes management, adult vision, and pharmacy. So with regard to behavioral health, in every market, we've made a concerted effort to remove the financial barrier to accessing mental and behavioral health needs, with the primary focus on lowering the cost of behavioral health office visits across all products. We're expanding $0 insulin to almost all plans in all markets and adding routine foot care and nutritional counseling to our no-cost services for members with type 1 or type 2 diabetes. We're also building out our adult vision benefit by increasing the frame allowance to $150 per year. And then from a pharmacy standpoint, the majority of our plans will continue to offer affordable access to generic drugs at $8 or less. Overall, our pharmacy benefit will be simplified with a 4-tier structure: generic, preferred brand, non-preferred brand, and specialty. So again, we'll go into some of that in more detail, but this slide sort of captures all of those enhancements for 2025 on one slide. Again, we've talked about the expansion in our IFP markets, the addition of 4 new states. We're going to talk about our virtual care benefit. We've added some more vendors there. We've just addressed the mental health, diabetes management, low-cost prescriptions, and we've made some changes to our member incentives, specifically our health perks and our fitness benefit. So I will say this, though, be mindful that there are always caveats and nuances for applying our national strategy to each of our 30 states due to regulatory complexity and market-specific needs. So every state kind of has their specific nuances. There are things that they allow, things they don't allow. So again, I'm always going to defer you to our state-specific plan grids, networks, etc., to get the most accurate information. So what we're talking about here is just kind of general on a national level. So just a quick reminder, you told us last year you wanted copay plans. So we launched the copay focus plans, and they are now the most popular plans we have in our portfolio. Your feedback was instrumental in that, so thank you. These are very simple plan designs as they offer copays as opposed to coinsurance. It makes it very easy for you to educate your clients and sell these plans to your clients. And again, we have 34% of our members on this plan, but we're seeing new enrollees selecting these plans 43% of the time. Specifically, my states of North and South Carolina saw strong enrollment, specifically in our bronze copay focus plan. So these plans are available in all states except New Jersey and New Mexico. So again, when you refer to your state-specific plan grid, you may or may not see the copay focus family of products. So again, the plan grid for your respective state or states will be kind of the source of truth for what plans are available in those markets. All right, so let's come on, advance here. Let's talk about network. So because we're going to be in 30 states, it will be very difficult for me to discuss each state specifically. So two takeaways there. Number one, you can always do a network search. You guys are very well versed at doing a network search. Our plan web address there is werally.com. And I'll send this presentation to you all. I believe this is a hot link, so I'll get this out to you after the presentation. Number two, Jarvis, our agent portal. You can always do a network search through Jarvis. So again, there's multiple ways to ensure a provider is participating in our ACA network. But the good news is on the next page, we've tried to make this very easy for you. So if you scan this barcode or take a picture, this will launch you into all of our network maps for our 2025 ACA footprint. All right. So again, note the product network is always subject to change. This is not a complete network search tool. This will simply allow you to access our maps. for every state in our ACA footprint. And I'm going to show you exactly what this looks like here in just a second. So if you have your phone and you have the capability right now to take this picture, please do so. Again, I'll be sending this deck out after the presentation to your leadership, and they can forward it to you. But this is the best way right now to access on a high level our network maps for 2025. So I'm going to flip over here just a second and show you what these network maps look like. So I'm in North Carolina. I manage North Carolina. These have been incorporated into all my training decks. So if you look at the left-hand side, we're going to show you a map of the state. If there are any counties in that state that we're exiting, we're going to give you some very basic, high-level, quick state facts. How many total counties we'll have in that state. Sometimes we'll note specifically how we're kind of filed in that state. So, for example, North Carolina, we're what we call a non-gated HMO. So non-gating means a member does not have to select a primary care physician or get a referral to see a specialist. That may be different in some of our other states, so pay close attention to that. We're also noting network changes from this year to 2025. And then more importantly, as you can see here, we break down our maps noting the main market area or geography within the state, the specific counties located in that market area, and then some of the larger hospitals, affiliated physicians, health clinics, etc., that kind of anchor those market areas. So again, previous page, when you scan this barcode, again, it will bring you to the landing page for accessing all of these state-specific maps. And as noted, the provider network is always subject to change. And then I would always recommend doing a thorough network search if you're looking for a specific provider. But this will hone you in on where we're going to be essentially selling in each of those particular states. So just another example, South Carolina, same thing. You'll see the state here with shading, quick state facts. Some of our states do have cross-border coverage, meaning a member can live in one state but access providers across the border in another state. So pay close attention to that. Again, we note our network changes, and the good news for South Carolina is we're adding a lot of new counties for 2025, so that's exciting. We're exiting a few, but again, market area, counties, and then some of the larger hospital systems that kind of anchor the network in those market areas. So again, these maps will look very similar from state to state to state. Okay. So again, just wanted to give you specific examples of what those maps will look like when you access them. So from a product standpoint, again, we can't review 30 state-specific product grids, but let me kind of show you on the next page a similar process to obtaining all of the plan grids for your specific state. So on the upper left-hand corner, it notes Jarvis. Again, that is our agent portal. And the web address for that is www.uhcjarvis.com. So uhcjarvis.com. That's how you enter the agent portal. Once you're in the agent portal, You're going to navigate to what we call our Knowledge Center. Very easy to find in that blue banner across the top. You're going to hit the Knowledge Center drop-down box, and you're going to select Resources. And within that Resources category, you're going to see Benefit Grids. And as noted here, you're going to see all of the 2025 state-specific benefit grids, and you are allowed to download those and save them in a PDF format. So again, Jarvis, get to the landing page, the home page, navigate to your Knowledge Center, drop down to your Resources, and then you can find all of your benefit grids right there. And on the next page, I'm going to show you exactly what those benefit grids will look like. But that is the best way to access all of the state-specific benefit grids. So on the next page, here's what they look like. I'm not going to go through North Carolina specifically, but you can see the plan name, the appropriate metal level. We've broken down high-level benefit information such as deductible, out-of-pocket maximum, PCP, mental health, specialist, virtual urgent care, inpatient hospital care, outpatient surgery, and office-based labs. Very straightforward benefit grid for each of our states. And I do want to note under the plan name specifically, let's see, let's find one here. Come on down to the second plan, UHC Bronze Value Plus. The plus is going to signify that plan includes adult dental and vision. So if you want a plan within the portfolio that includes dental and vision, you need to look for that plan sign. Again, it's very clearly noted in the plan name. But again, I wanted to call out specifically looking for that plus sign. And again, as I noted previously, these grids are available in Jarvis and you can download them. So page 2 of the plan grid is all the prescription drug coverage that ties to that specific plan. So you can see if there is a prescription deductible. On tier 1 is kind of the healthcare reform tier. That is your $0 cost share preventative drugs that are required to be included. So, you know, generic, preferred brand, non-preferred brand, and specialty, pretty straightforward. Y'all are very comfortable, you know, reading a prescription drug, you know, benefit summary. So again, when you link to your plan grids through Jarvis, this is the information that you have access to. Your medical and dental, your medical and prescription benefit grids. So again, that's this is what South Carolina looks like, you know, much like North Carolina. The formatting of our benefit grids are very, very much the same state to state. And this would be, of course, your prescription drug grid. So everything's laid out, you know, very, very clear, concise, pretty straightforward, easy to navigate. So let's talk a little bit about our vision benefit. First of all, pediatric benefits, those are offered or included in all states on all plans as required by the ACA. So that's fairly straightforward. That's easy. The adult benefits, those are offered in all states on select plans, as noted with the plus sign, except in Colorado, Washington, New Jersey, and New Mexico. So for whatever reason, those 4 states don't allow the adult vision benefit. Okay. And again, I noted before that the availability, and it's noted on the plan grid, is it states, you know, dental and vision, and then it has the plus sign. So one of the changes for 2025 is that frame allowance was increased to $150 on the adult vision. And then there are no waiting periods on our adult vision as well. All right. Next page is dental. So again, our pediatric benefits. There's always nuances offered in all states except Washington. So it's embedded in all plans across all product families, including FFM standard plans at all metal levels, bronze, silver, gold. And then our adult benefits, again, all states with the exception of Colorado, Washington, New Jersey, New Mexico. I don't know what's going on with those 4 states, but for some reason they don't allow us to include that benefit. And it's offered on all product families at all metal levels, again, indicated in with the plus sign in the plan name. And again, that's very straightforward on the state-specific benefit grids. And there are no waiting periods on our dental. And again, I'll have this deck shared with you all so you don't have to try to remember all this. So, urgent care, our virtual care offerings are evolving in 2025 to offer a broader suite of vendors. So your clients can all access the care they need when they need it, where they need it. Some of you may be familiar with Galileo. Galileo will become an in-network provider available to all UHC IFP customers to select as their primary care provider, regardless of the product family they purchased. Again, not all states require the selection of a primary care provider. So I just want to note that. Again, one of those nuances, one of those differences. But for urgent and on-demand virtual visits, we'll offer 2 options for consumers to choose from, Amwell and Doctor On Demand. So these virtual care visits are supported on these vendor platforms and will be available to consumers at $0, no cost on most plans. So again, you can see my asterisk on the verbal most plans. There are some exceptions, such as HSA plans and standard plans where this $0 cost share isn't permissible. Again, your plan grid, I think, is always going to be the source of truth for your specific state. So, cool thing is we have a new member incentive that we've changed for 2025. Our member incentive is increasing from $100 to $150 per adult member per year. And we've also decoupled the reward criteria, so all members are eligible to obtain a reward. So let's take a look at some specific things here. This does a nice job kind of breaking down that incentive. So it's a $150 decoupled product incentive. On the left-hand side, you had the $100 incentive for a PCP visit. Again, there's a couple exceptions here, and that is New Jersey and New Mexico. And you can kind of read the difference there. And then on the right-hand side, we have a $50 additional part of that incentive for completing 4 account-related actions, such as creating a myuhc.com account. That is our member portal, myuhc.com. The member needs to turn on the auto pay feature, sign up for all text message communications, and sign up for all paperless communications. And the way we provide them with this reward is we load it onto a Visa debit card. So again, just a couple changes with our member incentive there. Fairly easy. PCP visit on one side, $50 account-related actions on the other side. We also are kind of building out our fitness benefit. Digital fitness is available on all plans, and it is free. So that will be continuing in 2025 on all plans. We have over 40,000 digital classes For our members 18 and over, they'll have access to these digital fitness classes. And then on the right-hand side, new for this year, we're going to give our members the option to buy up. There's going to be 4 options to choose from for access to gyms and fitness centers, yoga studios, all kinds of cool stuff. So again, we don't have the pricing right now for these 4 tiers, but we'll be offering a classic, a standard, a premium, and elite. And there's different vendors that will live within those 4 buckets. And I'll follow up and get you more information on that. The good news is if you do buy up to one of these, one of the 4 tiers, it will include a free AARP membership, a Walmart Plus membership, and a Shipt membership. So if any of you have liked that or used those in the past, they'll be included when you do a buy up. So again, the cost is going to range from, less to more, depending upon what tier a member buys up to. So from an operations standpoint, we've made significant enhancements to our agent portal, again, which is Jarvis. Additionally, with the significant growth to our Hispanic population, we've added Spanish language support in several key areas within our IFP practice. So let's talk about some of the recent enhancements. Around this time last year, we made several enhancements to Jarvis. We built out what we call our age-in reporting, and that's specifically who is becoming eligible for Medicare or they're turning 26 and aging off the plan. These reports are incredibly helpful in ensuring continuity of coverage for your clients. We've also added late payment reporting on Jarvis. This is our #1 visited page. This report displays any of your members that have fallen behind on their payment. It shows you, without having to click anything, how many days are left in their grace period, what their premium is, and their balance due, and more. We've also made member invoices available. So let's say you reach out to a member and they're confused about what they owe and why. Back on the member profile page, you would scroll down and you can see up to 10 of their last invoices and have what you need at your fingertips to support them. Also, as part of our age-in and late payment reporting, you have one-click capability to send an email pre-written for you, but you can edit it if you'd like. So you can reach out to your members either individually or everyone on that same list at the same time. So made it real easy for you all to communicate with your members that are aging in, off, or have late payment issues, etc. And changing PCP, again, this is applicable in some states, not in others, but through Jarvis, you can help a member change their PCP and also access the member ID card on their behalf within Jarvis. So again, Jarvis is awesome. UHCjarvis.com. So what's new for 2025? Well, Jarvis has a new homepage, and I don't know if any of you have been out to it yet, but it has a fresh, new, clean, and intuitive design. We've put a lot of metrics at a glance right there for you. We also have actionable reporting. The age-in and late payment are now front and center. Establish quick links where you can customize your experience and have the features you use the most right at the top. It also allows, what we do is we highlight new features to get your attention. So great redesign. So you can kind of see what that looks like on the right-hand side of the slide. I know it's not the most clear, clear in the world, but again, I encourage you to go out there to Jarvis, navigate around. You'll see exactly what I'm talking about. So some enhancements we've made for this year were aimed at fine-tuning your direct experience within Jarvis. So we've included what we call an app status report. This will be super handy during OEP. It allows you to get all that information into a format where you can filter, sort, and then take whatever actions are indicated. So again, the app status report. We've made the agency book of business available at the agency level. And we've also changed our sales and marketing page. We used to be the toolkit, but now we refer to it. It's called our sales and marketing page. We're going to cover this on the next slide. So a lot of great information on our sales and marketing page. So again, we've sunset the toolkit for IFP and created this new sales and marketing page. This page will house all marketing materials on Jarvis. So if you look at this particular slide, you'll see we've broken it down into sales support materials, such as Facebook posts and ads, postcards and flyers, book of business touch points to help keep your customers engaged, specific to renewals, onboarding, and ongoing engagements. And then we have event support items to help you leverage the United Healthcare brand, banners, tents, tablecloths, United branded giveaways. So these are all available on the new sales and marketing page on Jarvis. So if you enter Jarvis, you're going to see, right there, they're going to call attention to help you navigate to that new sales and marketing page. They've made it real easy for you to get to it. We've also built out what we call an agent hub and Hispanic guide. So the agent hub specifically is essentially our IFP agent demo and video hub. We have links to member education videos that include onboarding, plan usage, renewal. Again, we live kind of in that TikTok era and Instagram era, so everyone loves videos. So again, lots of member education videos. Again, encourage you to go out there, use them, send them to your clients. Very, very helpful. And then we're also in the process of completing our Hispanic guide, and that's going to contain what we call our new Hispanic materials playbook. So as our Hispanic enrollment grows and continues to grow, we're making sure that we're providing material to our Hispanic agents, our Spanish-speaking agents, and their clients that they represent. All right, just a few more things on the Spanish language support. Obviously, you can tell it's an important area for us because a large percentage of our membership is a Spanish speaking, as well as a lot of the agents that represent us. So for onboarding new agents, we have materials available in both English and Spanish. Many of our 2025 OEP rollouts right now are being conducted in Spanish. Our IFP Connect newsletter that you all receive has been available in Spanish since last year. And then again, we have member-facing communications available for you to use directly from the sales and marketing materials page on Jarvis. And we've also expanded our producer help desk. We've added new agents to our producer help desk and Spanish-speaking agents as well. So very exciting there. And then kind of lastly, before we wrap up, we'll talk a little bit about just some compliance resources that are available to our agents and brokers. We have a compliance resources page on Jarvis that includes our IFP Pledge of Compliance. We also have a compliant selling training module that agents are allowed to go through at their discretion. We have what we call a complaint reduction playbook. And then we also have some agent oversight enhancements as well. And again, as noted in our IFP Connect newsletter, we always have a compliance topic in that newsletter. So every newsletter that's produced, we're calling out specific compliance topics. And then some of our larger agencies, including Healthcare Solutions team, we have now implemented quarterly meetings with our compliance team to review kind of results and best practices. So again, HST is very engaged with us on helping us, work through any potential issues with agents. And so again, just doing as much as we can there to, sort of right the ship, if you will, because it's a little crazy out there right now. Let you guys again, kind of screenshot this if you want to. These are our state-specific member services contact numbers. And again, this is for the member to contact. So again, notable there. And then below we have specific departments, claims, eligibility, benefit questions, dental benefits, vision benefits, HSA eligible plans, prescription, Optum virtual care, and our Kelsey Siebold, which is in Texas. So just wanted to provide you with some key contact numbers for our members to reach out to. And then you as the agent, y'all use what we call our producer help desk, and they are here to help make your sales process easier with United Healthcare. And they should always be your first call as the agent. And the reason I say that is because the producer help desk team will always establish a service request number that is used to track a service request or issue. And it's very important to have that number because that allows them to sort of track, an issue if it's not a single call resolution. They help you with things such as contracting, sales support, application status questions, and commissions. Commissions is a big one. We always encourage our agents to reach out to the producer help desk if they have a commission inquiry. So again, they're available by phone. If you need to access a Spanish-speaking representative, you would press number 2 on the prompt. You can email the producer help desk. And then always very helpful when you call in, provide your full name, your producer ID number, your writing ID number, tax ID number. If you're calling on behalf of a member, it's always important to give the member's full name and at least 2 of the following: their date of birth, their policy number, or their full permanent address. And that enables the PhD team to look up that member and help you quickly. If you're in Jarvis, UHCJarvis.com, you can chat with our producer help desk via the chat feature in Jarvis. You can also send a secure email request via Jarvis as well to our PhD. So a couple different ways to get a hold of the folks in our producer help desk unit. So if you feel so inclined and you want to share any feedback on this training module, please do. Feedback's always important. I know these are a little bit difficult on the national FMO level because, us carriers have so many different states, different plan designs, but we've kind of done our best to sort of bring you the information that we think is going to be most impactful, or more importantly, how to find it. So we appreciate that. And then Again, here's my contact information. Again, I manage North and South Carolina. So what I may try to do, and I've actually sent this out already to the team at HST. I'll ask them to distribute to it, but it's all of the contact information for every agency manager across our footprint. So again, I sent that out prior to this presentation. I'll just follow up and ask that they make sure it's distributed to all of you downline agencies and agents. That way, if you're on this call and you say, "Hey, I'm sitting in Texas, and I really need to know specifically about, what network changes we're looking at in Texas," you'll have that contact information to reach out to our Texas agency manager. So I'll kind of stop there. Let's see if anybody wants to unmute from HST.
Good stuff, Todd.
Cool. Was that helpful? I hope it was.
Incredible. And folks, if you're online and you have questions, go ahead and pop those in the Q&A, and Todd will go ahead. There's a couple in there already. Todd,
Yeah.
if you want to go ahead and click
let's
that Q&A,
see.
it's at the bottom of the screen.
Bottom of the screen,
Yep.
Q&A. Okay. I'll do my best here, and if there are some things that we need to take away on, certainly. Shrimp boat, absolutely, right on. That's a shrimp trawler. Yes, it's Cape Lookout Lighthouse, 100%. Good call there. I was out there fishing one day, and this shrimp boat was coming back in. I think they were based out of like Harker's Island, if anybody knows where Harker's Island is. But yes, that is Cape Lookout. Sits out on the Outer Banks. It's a very beautiful place. Let's see here. A lot of doctor in Central Kansas will not accept United. What should we tell them? That's a tough one, folks. I'll kind of answer that generically. One thing you're going to find with United Healthcare is, as you would with CIGNA or Aetna, sometimes the Blues, is we have commercial networks, we have Medicare networks, and we have ACA networks. And sometimes these providers are part of all three. They may be part of two, one, or none. So what I would say to you is when I provide you guys with our agency manager contact information, if you have a specific network question, all of us agency managers have an internal contact at United Healthcare that manages the networks for our state or our region. So they can really dive in and really help you with that question relative to Central Kansas. Let's see here. Is there compensation on the fitness buy-ups? I don't believe so, Timothy. I'll use that as a takeaway, but I believe that's just at the member's expense. How are AORs going to work for OEP if they are enrolled with an agent for 24 and they want to be with me for 25? Well, I need to do a three-way market. I may defer, Peter, back to your internal folks. Honestly, I guess to answer that generically, we're taking that file feed from CMS. So that's kind of our source of truth on the AOR. I know the marketplace has implemented some new requirements for you all, and I saw one earlier today that said something about a social security number now being tied to a member application. So these changes are happening all the time. Again, I would kind of defer to your internal compliance team to maybe address that and what is the best practice to capture your member or client acknowledgement, if you will. Again, I just saw something today pop through. I didn't have a chance to read it, but it had something specific to do with Social Security number now being required, and then a three-way call if that's not able to be provided. Don't quote me on that. I just saw it, but yeah, that's pretty much it. Steve, I see you're on the call. Earlier, Steve, I did email you our one pager for all of our state specific agency manager contacts. And I've sent that to you, Dan, and Joe. So please feel free to distribute that. I think that's going to go a long way.
We'll get that out to everybody.
Yeah, I think that's going to go a long way towards helping your people that are in specific states really drill into where are you expanding. Help me with the plan grids, all of that good stuff. How's that sound? And I'll get you this presentation as well, everybody.
Thanks. I think you got another question in there.
On the network piece, when I look up doctors on Health Sherpa and their doctor does not show up, are there any other ways to look up a doctor to see if they're in the network? Yeah, that will be in the presentation. I think it's a hot link. So when I send that out to you, you'll have the ability to do that, the network link there. And also in Jarvis, the agent portal, you can also do a state-specific provider search as well. So there's a couple different ways to do that. So I'm going to give you guys it in the presentation, and then again, note in Jarvis, and I'll try to be more specific as to where that's located in Jarvis. Those are really the two best ways to do it, in my opinion.
Okay, I guess that pretty much wraps everything up.
All right. Well, I appreciate you all. I will send out this deck to Steve, Joe, Dan, and you can distribute it accordingly. And if there's any other questions that pop through, feel free to let me know.
Thanks for everything today, Todd. It was really good.
You're welcome.
And we'll get the agents out there selling your stuff, buddy.
Awesome. Well, we appreciate you all. HST is a big partner of ours. This is great. We really appreciate all you do for us.
Awesome, sir. You take care. And the rest of you folks, this is going to conclude our day 2 of ACA University.